Hello and welcome to the Tallaght University Hospital podcast series of Let's Talk About. In this series, we are going to talk about diabetes. You will find this and our previous series on the hospital YouTube channel, Facebook page, Apple Podcasts and Podbean. Each episode is for people with diabetes, their families and carers, health and social care staff, and anybody who has an interest in the health needs of people with diabetes. We will speak with experts from the HSE's Chronic Disease Management Hub here in Tallaght, who specialise in diabetes support and management, and our own experts in the Diabetes Day Centre at Tallaght University Hospital. This Let's Talk About Diabetes series has been brought to you by TUH in partnership with the Healthy Communities Development section of South Dublin County Partnership. My name is Valerie Twomey. I am a clinical neuropsychologist and head of psychology at Tallaght University Hospital. I also work directly with patients in the TUH Diabetes Day Centre. In this episode of Let's Talk About Diabetes podcast, I am delighted to welcome Michelle Tracey, a person living with diabetes, and Ann Fitzpatrick, Advanced Nursed Practitioner in Diabetes Care. A big welcome to you both and thank you for joining us.
Good morning.
Thank you, Valerie.
Thank you.
Michelle, it's lovely to have you here and I'm really interested to hear your story. So, can you tell us, what's it like to live with diabetes?
Well, it's a little bit scary. It's definitely something that I didn't expect to happen, but it's kind of something like I just get on with, do you know? It's nothing that I can change. So I just get on with it, basically. My day-to-day is pretty standard.
And where did your diabetes story begin?
So I was diagnosed with type 2 diabetes to start with in April only, and the doctor put me on some metformin tablets and he told me that I definitely just had to persevere with them. But they made me very, very sick. Very sick. And so the first time that I met Anne, she told me just to kind of deal with it just for a little bit and see if it settles down. But when I went back a couple of weeks later, it was appalling. I was really, really poorly. And so she said, just throw them away.
Okay. What were the symptoms you were experiencing?
I was vomiting. I had explosive diarrhea. It was horrendous. And I was just really a shadow of myself. I'd gone very introverted. It was awful. And when Anne saw me when I walked in the second time that I met her, this was only the second time, she said, oh, good Lord, throw them away.
Okay.
And she put me onto insulin straight away. And from then, really, I haven't looked back.
Okay.
Yeah.
I might actually ask Anne, so you were key to that change for Michelle, I can hear clearly. What was it for you that triggered the change? What were your concerns when you first met Michelle?
Well, Michelle, the day she came in, like she said, she was having a really tough time. The symptoms were just not tolerable and it was really impacting negatively on her life. So I collaborated with our consultant, Dr. Shamil, and we did some blood tests and it really was loud and clear when the blood tests came back that Michelle needed insulin. Okay. Her blood sugars had been uncontrollably high for some time at that stage, basically constantly since April. And she was not functioning day to day. She was really unwell. And had this continued, she would have ended up in the emergency department.
Okay. So we've talked in an earlier episode about type 2 and type 1 diabetes. So Michelle, your story is of both. Tell us a little bit about what it was like to experience that.
It was a roller coaster, to be perfectly honest. Type 2 was something out of left field. I kind of said to myself, grand, change my diet, lose the weight. You know, I'll beat this, no problem. I thought I kind of just had my mind set on getting rid of it. That was the entire mindset. And then once I was told that I was type 1, it kind of knocked me for 6. I was kind of upset, a little bit shocked, really, that it was type 1.
That must have been like a bolt out of the blue.
It really was. definitely a bolt out of the blue. But again, it was just a case of, okay, so this has changed. Let's just deal with it day by day. And that was how I got through, basically. Yeah.
And are there things that you do routinely to make life easier or that you have to do now with living with type 1 diabetes?
I have to set my alarm, and I'm so ashamed to say it. I have to set my alarm now to take my Lantus, which is the slow release insulin at night, because I've changed. It was, to start with, it was in the morning, and I had to change to nighttime because I noticed that there was a spike in the morning of my blood sugars, so they'd gone higher. Like normally a Lantus says it lasts for 24 hours, but it doesn't. Around 20 hours is what you get. So I set my alarm just to make sure, to remind myself that I have to take it at a certain time at night.
Okay, so that's your evening behaviour.
Yes.
During the day, what are the things you have to do?
So I have to take my insulin before I have my breakfast. So I do that about 10-15 minutes before I have my breakfast. So when I go in to work, I tend to eat my breakfast at my desk. And then, so I take my insulin, the fast release, and then eat my breakfast. And then by about lunchtime, by about 1 o'clock, I notice that my sugar's starting to drop. So I'll take a little bit of insulin and then I'll go out and have my lunch.
There's a lot of kind of pre-eating behaviour in relation to the insulin. And are you injecting or taking a tablet?
Injecting. Yeah.
How many times a day?
So I inject probably 3 times definitely for the fast release, which is the Nova Rapid, and just once a day for the Lantus, which is at night time. Now I do that in 2 stages because it's quite a lot to take in one injection. So I'll do 2 lots of 16. At the same time, but kind of like a little break of a couple of minutes between, and different sides as well. Like I inject into my stomach, so.
Yeah, it's not a surprise to me to hear you're setting alarms, because I think that is something that's really good behaviour. You said you were ashamed, but I actually think that's really good behaviour, because there's a lot to manage, Anne, isn't there? As a type 1 or a type 2 diabetic, there's a lot to think about and a lot to have to consider. And I imagine it's different depending on the person. Can you tell us a little bit more about the routine and the schedule that people living with diabetes have?
Look, it's so different and it's so individualised, and it must be individualised to fit with the patient. Unfortunately, insulin only comes in injectable form. There is no tablet version of insulin available. So patients that have needle phobia, like it's so challenging for these patients because they can't survive without insulin. So it is setting alarms. It's doing whatever it takes to keep well. And, over the years, I've learned so much from my patients, and have so much respect for patients with diabetes, because it is a lot to carry through life. Life has, we all have our challenges in life, but adding diabetes in there, but it's a real can-do attitude. And I think once you know your patient and you gain that trust, and you are there and they know you're there as a support, and you get them as informed and up to speed with the latest tech, for example, for type 1 or type 2, the other resources and the many improvements in medications now, it really is a much better time to be alive nowadays for diabetes, much more positive.
And education, you mentioned earlier, is so important. Michelle, thinking of all the things that you have to do on a daily basis to care for your diabetes, how would you say they affect your life? You mentioned you work, for example, family, social life. How does it affect you?
I do. So it's as Anne mentioned, it is a lot to remember. And it's just a case of getting yourself into that position of remembering, right, I have to take my insulin now. I have to, if I'm having a snack even, I have to take insulin. If I'm having a drink, I have to make sure that I don't take insulin for any snacks that I have. It's a lot to remember, and it's not difficult on a day-to-day basis for the fact that I have a very good support system around me. Like my husband will say, did you take your insulin? Or my son will say, Mum, what's your sugars? Because he's diabetic too. So I have a great support system. If I do forget anything, they remind me. Or as I said, I have my alarm set on my phone for certain things, So yeah, it's not much of a difference in the day-to-day.
And I do hear from other people living with diabetes, sometimes traveling can be difficult, like going on a holiday or taking up a new hobby. It can impact because, again, you're that remembering and that routine. Have you experienced any challenges with that?
Yeah, definitely travelling. Like if we go up to my mum, she's 2.5 hours away. So I have to make sure that I have a snack in the car, even a banana or a drink. Or, you know, one or two things just to make sure that I have them in the car at all times. Like I have little stashes everywhere of Lift drinks. I have 2 in the car. I have 2 in my bag. I have 2 in my desk at work. You know, they're all over the house. It's just in case, you know, my sugar drops, because it does drop rapidly.
Yeah.
So, yeah, I just need to make sure that I'm prepared. And it's that preparedness that kind of makes things easier.
You mentioned your husband and your son, and I think it's really important that we do acknowledge the support of people who support people who live with diabetes. So what supports, practical, do you get from family, friends and the professionals?
So I would be absolutely lost without Anne, because she's incredible. She's always there if I need her, on the end of the phone or even just a quick email. She's always there with advice, and, you know, if I need something, she's always there. My husband and my son are just the best in the world, and I'm so very, very lucky to have them. They always remind me, you know, just a little, you know, have you done this? Did you do that? You know, it's great to have them.
And Anne, how important is it to be on the end of that phone or on the end of that email for people living with diabetes?
So in as much as possible, I do try to get back to all my patients promptly. Email works really, really well, you know, and the key is getting back and nipping things in the bud, you know, catching things, as opposed to not, and the patient deteriorating or becoming so ill that they end up in the emergency department. So it is really important. And once you've got trust, I mightn't hear from patients for weeks and weeks and weeks, but I know if they check in, there's something up. So it's working well. It's a good two-way system, I think.
And Michelle, we're going to be hearing in a later episode of the podcast from some of our other experts on complications related to diabetes. Is that something that weighs on your mind? Is it something that you think about a lot? Or because it's quite common to have some complications as we age well with our diabetes.
It is, yeah. Like, for example, my eyes, I was a bit worried about my eyes because they were going blurry, but Anne kind of allayed those fears with the high sugars. My eyes were going blurry. So they're not as bad anymore, but I have definitely deteriorated. But that could be not just the diabetes, but the job that I'm doing. And my feet are a weird fear at the moment. Just I don't like anybody touching my feet. So I'm worried that when I have to go to have them looked at, somebody's going to touch my feet, and I don't like that.
Well, like Anne said earlier, you know, there are people who have needle phobia, and there are people who don't like to have their feet touched.
Yeah.
And as a person living with diabetes, you have to have your feet touched. Yeah?
I know.
So it's a real issue, isn't it?
Yes, no, it really is.
The personal work of caring for your diabetes can be very emotionally challenging as well. What has been your experience emotionally? You mentioned scared very early on in this episode.
Yeah.
And that bolt from the blue. So how do you manage?
It's just a case of I get on with it. Like, I deal with everything that comes as it comes. Do you know? When I was diagnosed with type 1, I'm not going to lie, I was terrified. But as I explained, I have a unique perspective because my son is type 1. So I knew what to deal with, what to expect. Do you know? But it's still, when it's happening to you, it is scary. It is kind of, oh dear God, what am I going to do? But you just get on with it. That's the best advice I can give. And use your supports. Your supports are very important, and they're there for you.
That's lovely to hear. Before we wrap up today, I'm going to come back to Anne. We're talking about the lived experience of diabetes. Is there anything further you think that our listeners might like to learn from this episode? A take-home message, perhaps, maybe for our listeners.
So, diabetes can, as Michelle has said, can be scary, is scary, can be really overwhelming. So I'd like patients, anyone listening out there who's affected by diabetes, there's so much support out there and it doesn't have to be negative. We do hear the nightmare stories of leg amputations, blindness, and yes, it is a reality. It does happen, but it is preventable for the most part. Self-caring, empowerment, all of those words, keeping our patients well informed and knowing, I can't stress enough, knowing where to go for help, who to contact for help if they feel that something is not right, if there's a little cut on their toe not healing up, if the sugars are spiraling out of control, regardless of the treatment that they're on, because type 2 diabetes is a progressive condition. Eventually the patient with diabetes, type 2 diabetes, may end up on insulin. And at the other end of that spectrum is patients have come to us and have had so many changes to make to their lifestyle that they have actually reversed their diabetes. Wow. Now that's not to say everybody can do that, but you're talking about patients who have come from a place where they were really not self-caring and they were, the diet was not the best diet, shall we say, and they maybe had a lot of weight to lose. They have either stabilized or reversed their diabetes. So each patient is going to have a different story. We meet our patient where they are and speak to your health professional. Don't be taking advice from Mary down the road who's got type 2 diabetes, because it's not you. So that's really important.
I see Michelle nodding as you're saying that. And I do get a real sense of team from the two of you, that you work very much together as a team, collaboratively. So Michelle, same question for you. You really are living this condition. So what do you think our listeners might like to take home from your message today?
Definitely lean on your team, because they have just helped me so much. It's been a roller coaster from being so sick to being where I am now, where I'm fine. I'm just literally dealing with it as it comes along, as I said, but do lean on your supports. Don't, as Anne said, talk to Mary down the road, because you are different.
Well, thank you, Michelle and Anne, for coming to talk to us all about living with diabetes today. In our next podcast, we will be joined by Fiona O'Shea and Rachel Shane, community dietitians, talking about diabetes education. This Let's Talk Diabetes series has been brought to you by TUH University Hospital in partnership with the Healthy Communities Development section of South Dublin County Partnership.